Great to see you again. Uh, the President's budget request for fiscal year 2023 proposes critical investments in public health and it advances health equity. Notably, the budget includes new innovative programs to amplify HIV prevention efforts and further LGBTQ plus equity and justice. As you know, LGBTQ plus people, and especially queer people of color, face health disparities linked to social stigma, discrimination, and denial of their basic civil and human rights, including under federal law, considering we still have not passed the Equality Act due to Republican obstruction. Under President Biden's proposed budget, the Department of Health and Human Services will be using an equity-minded approach, making sure treatments and preventative services are available to the most vulnerable communities, including Black members of the LGBTQ plus community. Secretary Becerra, I want to thank you for your commitment to strengthening the national HIV/AIDS strategy and working towards significantly reducing the number of new HIV infections in the United States by the year 2025. This proposed budget includes $9.8 billion in mandatory funding over 10 years to guarantee access to a drug known as pre-exposure prophylaxis, or PrEP, free of cost for all uninsured and underinsured individuals, and provide essential wraparound services like HIV testing. PrEP is 99% effective at preventing HIV infection. It is a life-changing, life-saving drug. It has been 10 years since the first FDA approval for this life-saving medication, yet there's still so much more work to do in making PrEP accessible for everyone who needs it. Access to PrEP has been inadequate and inequitable. While the rate of HIV infections among Black Americans is 8 times as high as among white Americans, just 9% of the Black Americans for whom PrEP is recommended have been prescribed this vital preventative medication, compared to 66% of comparable white Americans. This budget's historic investment in HIV prevention is critical to improving public health. And I've got 2 questions for you, Mr. Secretary. The first is this: what other HHS efforts are part of the Biden administration's larger HIV/AIDS prevention strategy? And the second question is, will the new proposal to make PrEP free of cost for all uninsured and underinsured persons extend to all FDA-approved forms of PrEP?
Congressman, first, great to see you again, whether it's in New York or here. It's great to see you. And thank you for your work in this space. President Biden made it very clear. We think if we really apply ourselves, we can eliminate HIV/AIDS as a threat to human life. And it's just a matter of putting our wheel to the grindstone. And so here we go. And the president has proposed, as you mentioned, a major investment over close to $10 billion over 10 years to try to really get us to the spot where we're offering services and the medicines that people need, in most cases free of charge and available to people, including in spaces where we often neglect communities. And if we do this, we think we can work with our partners that are locally on the ground already and providing some of those services, and we can make it happen. But it's going to take the effort that you and your colleagues can in pushing through this budget request so we can make those kinds of investments that people on the ground throughout this country are looking for.
Thank you for that, Mr. Secretary. In February, I sent a letter with Representative Richie Torres and 58 of our House colleagues urging CMS and the CDC to ensure that public and private insurance plans cover a new FDA-approved injectable form of PrEP known as Applauds at no cost to patients, just like the other forms of PrEP. As our letter describes, the research shows that this injectable form of PrEP is significantly more effective at stopping HIV infection than the pill form of PrEP. And recently, I was pleased to receive a response from the CDC that says, the CDC supports efforts to ensure no cost sharing extends to all PrEP medications approved by the FDA, including Applauds, and looks forward to continued collaboration with CMS to advance this effort. Mr. Secretary, I look forward to working with you on this effort moving forward, and thank you for your time today.
Thank you.
Thank you. The gentlelady from Michigan, Ms. McLean.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. I want to follow